I really appreciate you being willing to discuss that, Mr. Seelig, because I did have one question when I looked through the report. And by the way, committee, the report is on your desk with the letter that Mr. Seelig is discussing, and it had a lot to do with budget neutrality. But if you would just look on page 7, the thing that caught my attention as I read it, and I think you have alluded to it, was when, and I asked the GAO representative that I talked to this very thing. I wanted to know where they got these numbers, or where someone got them, and it was, for example, the state assumed that it would have to pay 67% above its fee-for-service payment rate for primary care services and for higher cost services, such as inpatient and long-term care services. And that seems to be the basis for some of the waiver process and what was asked there. But it sounds to me like what they're saying is that providers could have made more, been given more for their services if we had just expanded Medicaid, versus putting them on the private option, and we put them on the private option to save money. So can you tell me whether that's whether that's the right assumption, and who came up with those numbers?
Yeah, I think overall for the Medicaid program, I think the difference between what we pay in Medicaid and the private sector is about 25%. So, I mean, maybe 67% on one, it's 10% on another. Of course, it varies considerably. And what GAO seems to be saying is, because they're not convinced that HHS has enough questions to substantiate where we needed to go, their assumption was, well, without that data, we're going to assume you didn't have to increase rates at all. So that's where the difference is. In other words, they took existing Medicaid rates and said, you would have saved this much money. Of course, if we have to raise rates, let's say for an office visit, in order to get 200,000 more adults seen, we can't just raise rates just for those people on the private. We'd have to raise office visit rates for everybody. So there would be a significant cost to raising those rates. Again, it's hard to know exactly what GAO looked at.
Well, I think that I think in this particular report, the numbers came from Arkansas, the 67% and then the 10%. That's my understanding. When I talked with them, I said, where did those numbers come from? And they had no answer. They didn't know.
Right. Well, I think that's where the 67 and 10%, when you take it all together, it works out to about a 25% difference between what we pay in Medicaid currently and what the private market pays for similar services.
Okay, but was there assumption that we would save money in the private option versus expanding Medicaid? Is that am I clear?
GAO did not assume that.
CMS assumed.
Yeah, what we argued was that we thought it would be at least budget neutral, because the requirement in Medicaid, not that anything to do with private option, Medicaid, the requirement is you provide access to services similar to other people in that area. So basically similar to what people with private coverage get. And our belief was, if you're going to add 200,000 adults to the market, that's almost doubling the number of adults on Medicaid, maybe more than doubling, that we would have to approximate those private rates, or physicians would say, and others, I'm happy to serve 56 adults, but if you're asking me to serve 100 on Medicaid, I can't afford to do that at the rates you're paying. So we felt like we would have to raise those rates. And of course, our argument is, by strengthening the private insurance market and having more carriers come into the state, which is happening, that will help keep rates down from where they would have been. That not only keeps our costs down, that also keeps and GAO couldn't take this into account because of the way the waivers are done, that also keeps the federal government's costs down, because they're paying subsidies above 138 in that private market. And of course, it helps all of us who are paying for our own insurance, because it keeps our rates down. So we think the overall impact is at least budget neutral. We won't really know until we have a couple of years or more of analysis, and we can see what happens in other states. I mean, we can't sit here and guarantee anything. I think what I'd say is this is certainly an experiment worth doing, because if it works well, we can show that serving people in the private sector and using competition rather than expanding government programs is a good way to go.
Well, I appreciate that. That helps me feel a lot better. When some of the providers saw this, they said, when have we ever gotten 67% of, for fee-for-service? And so, anyway, that helps me.